So, good morning, everyone. I'm Harini Jeyakumar, and I'm here to share my findings of the research topic Epidemiology of Hereditary Spastic Paraplegia and its impact on mental health in England and Northern Ireland. So, this was a project that I did it during my Master of Public Health degree at the University of Birmingham, and it was under the supervision of Dr. Jot Singh Chandan and Dr. Shang Lee. So, little background. How rare is HSP? 2 to 5 people out of every 100,000 worldwide are being affected, and the number is slightly greater in Norway. It's about 7.4 per 100,000, and it's comparatively lower in Northern Ireland. We can see that's 1.3 per 100,000. While we have some data from certain countries, there is very limited data on the prevalence of HSP in the UK as a whole. So, my study is part of an effort to fill that gap and provide a clearer picture of how HSP affects people here in England and Northern Ireland, particularly with respect to mental health. So, mental ill health in people with HSP. One of the key findings from existing research is that beyond physical symptoms, mental health challenges are quite common as well. So, in fact, about 40% of the HSP patients experience depression, and about 20 to 30% of them report significant anxiety. So, the study had three key aims. We estimated the people that are living with HSP, and we call that as prevalence. And we also estimated the number of new cases of HSP each year, and we call that as incidence. And the other aim was to explore the mental health outcomes in people living with HSP, specifically the likelihood of developing depression and anxiety, because the numbers were quite high for depression and anxiety. It was 40% and 20 to 30%. So we chose depression and anxiety for that reason. And the methods, to achieve this, we use the GP records. So all the patient data that are recorded in the GP, that are recorded with the GP, they're connected to a larger database called the CPRD. And this data spanned from 2000 to 2021, and it included only England and Northern Ireland. We also used a 1:4 matching process where every HSP patient was matched to four other non-HSP patients in terms of age, gender, and geographical location. So the CPRD that I talked about is called the Clinical Practice Research Data Link. It has anonymized patients' records so we can't track back to the patients with the data. And we used the CPRD Aurum December 2023 database. It included 24% of the UK's population, and about 1,771 GPs are recorded with it. It includes England and Northern Ireland, but unfortunately, it doesn't involve the Scotland or Wales data. When I say 1,771 general practices, it means that about 98% of the GPs are registered with CPRD data. So it's quite a large data set that we have. Moving on to the results, in total, there were about 31.3 million patients from 2000 to 2021 who were included, and 99.7% of them were from England, and 0.3% of them were from Northern Ireland. Among them, we found that 1,455 of them were to be living with HSP, and 5,726 were categorized as patients without HSP. So the demographics of the patients is basically the age, sex, and the geographical location, ethnicity. We found that 58% of the patients among the 1,455 were males, and 42% of them were females. So it's quite equally distributed, I guess. And the age at index date is when they entered the study, and we found that 33% of the cohort, the majority, falls within the 31 to 50-year-old age group, and which is followed by 30% in the 51 to 70 age group. This indicates that the majority of the HSP patients were about middle age to older adults, and we found that only 12% of them were under 16. Moving on to the ethnicity data, a large part, about 65.3% of them were whites, and which is followed by 5.8% were Asians. Although we had a 27% of missing data because not all patients who are registered with the GP give out their ethnicity, or not the GPs might have had time to record the ethnicity data during their emergency cases. So that's one thing. Moving on to the health authority, the largest concentration of HSP patients were found to be in the northwest, about 20%, and in the southeast 20%, which is then followed by the West Midlands, about 16%. Very few patients, less than 1% in the Northern Ireland. Um, So we use something called the index of multiple deprivation for the deprivation data. It's basically ranked from 1 to 10, 1 being the most deprived area and 10 being the least deprived area. It's calculated based on the surrounding environment, based on the income, education, and occupation of the people living in that area according to the postcode. So we found that the patients are likely to come from the areas with higher deprivation when compared to the non-HSP patients. So this might have implications for access to healthcare and support services. Um, Moving on to the body mass index, we found that 28% of the patients fall within the normal weight range, normal BMI, while 21% of them were overweight and only 8% of them were classified as class 1 obesity. The smoking status of the HSP patients was found to be that 52%, that the majority of them had never smoked. Only 18% of them were current smokers, and 5% of them were ex-smokers. The prevalence is the number of cases in a population who have HSP, and we found that 2.83 per 100,000 of them in 2000, which had increased to 6.27 per 100,000 in 2021. Um, it's a gradual, slow but a steady increase. The incidence is the new number of cases that are being diagnosed each year. Um, it it's kind of fluctuating, but it's quite stable. And the highest peak was seen in 2017, about 0.39 per 100,000. Um, Looking at the pre-existing mental ill health, which is the depression and anxiety that in HSP patients, even before the diagnosis of the condition, we found that 19% of the patients had depression and about 12% of them had anxiety when compared to their other group. We did some logistic regression analysis and we found that HSP patients are 74% more likely to have depression and 31% more likely to have anxiety when compared to the non-HSP group. We also did some regression to find the future mental ill health, which is to see if the patients go on to develop depression and anxiety in future. So we found that HSP patients are 57% more likely to develop depression and 41% more likely to develop anxiety over time. We also compared the risk across different characteristics, and we found that people living in the most deprived areas are at higher risk of developing depression and anxiety compared to those in the least deprived. Also, females are more prone to developing these conditions when compared to males. However, Asian individuals have a decreased risk compared to white individuals, but this number should not be taken as a certainty because research shows that Asians might not access healthcare because of stereotypes and stigmas. So, because of that health seeking behavior, we cannot say this with certainty, but it should be taken into consideration that Asians have a decreased risk when compared to whites. So the key findings of this research in conclusion says that people are living with HSP now than 20 years ago, but the rates of new diagnosis remain stable, which means that we saw that in 2000 the cases of HSP was about very low, like 0.63, and it almost doubled. It almost went up 6 times. Yeah, 2.83 in 2000 and went up 3 times to 2021. But the incidence actually remains kind of stable. So we can conclude by saying that the new diagnosis remains stable while the number of cases, overall cases, have been increasing for the past 20 years. And we can also say that the HSP patients are more likely to have depression and anxiety when compared to others who don't. And the strengths and limitations of this study would be that we had a large data set which covered England and Northern Ireland. However, it did not include Scotland and Wales. So we don't have UK as a whole, but we have England and Northern Ireland. We also had part of missing data, and we did not include genetic data. We did not include the genetical characteristics of the patients. Um, So moving on to discussion, it would actually be really helpful if I could know what you all think about the findings and if anything else that you would have liked to know that could have been done in this study, and if there's any chance that we can use these findings to improve care and treatment strategies in future. And I'd also like to thank all the support group people for the input that I had during the initial stages, and actually for this opportunity to be here to present these findings. Um, thank you, and yeah, that's it. I think that's it.
That's wonderful. Thank you very much, Harini. It's a really nice presentation.